Well, hello, everybody. It's officially 7 o'clock. Let me start my timer. My name is Jamie Textor. Welcome. Glad to spend this half an hour with you this evening. I'm just going to give a couple minutes before we dive into the topic, in case we've got a couple of people still yet to join us. And I'll spend those couple minutes just giving a brief couple of comments about Sleip as a tool, if you don't mind, because we may have some folks on the call that are not yet Sleip users. And so need to cover just some basic concepts, I think, before we get started. And again, a more proper introduction. Welcome very much to this webinar. It's the first one that we're offering dedicated specifically to the North American time zones. Of course, it will be recorded, so you can share it with all your friends later as well. It'll be on the website along with all of the other existing great webinar content that's there. Check out all those as well. But this is the first one tonight, so I'm glad you're here with me. We have specifically chosen a kind of a bite-size a window of time and a very specific topic. So we can really dig into this specific, practical, topical question regarding nerve blocks and the use of Sleip as a tool in their interpretation. And we're going to spend the next 30 minutes talking together about it. I'm going to talk for about 20, and the plan is to then have the final 10 be for questions. So if you would please use the Q&A as we go through the presentation tonight. I'm alone. I don't have another moderator tonight. It's just me. So I'm going to present my slides to you and talk it through. And then hopefully in about 20 minutes, we'll just get busy with reviewing that Q&A pane. And then if there's anything left over at the end of 30 minutes, I'll certainly encourage you to reach out to me, or I'll try to follow up with you by email. So great. Again, my name's Jamie. I'm the director of the North American market for Sleip. I'm an equine vet like you, although not practicing at this moment. But I've been out in the trenches. I've been in referral practice, and I find myself now working for this amazing tech company in the field of objective gait analysis. And what is Sleip doing exactly? Well, Sleip is an asymmetry detector. So Sleip, like many other objective gait analysis systems, uses the vertical asymmetry. That is, if there's a difference in the vertical position of the head, body, or pelvis between the left limb versus the paired right limb during those two strides, then that asymmetry is reported to you very quickly, as it turns out, and by computer vision analysis with no markers in the case of Sleip. And that asymmetry that may be detected is important because we know that it's a very robust proxy for limb lameness. Okay, not always, but often. Okay, most of the time. So Sleip works off your phone. It uses an iPhone or an iPad. It is a data collection portal from the phone and the app on the phone. And then if you have a good Wi-Fi connection, you upload that recording to the cloud. Then you have your results analyzed and processed and relayed back down to your phone within 5 minutes. Okay, so let's get started. Let me share my screen with you. Looking forward to digging in here with you tonight. All right, excellent. So the topic you know already, you signed up for it, how to evaluate blocks using Sleip. And again, this is a pretty specific question. It's one that comes up a lot that people are interested in. And so we're going to give you some couple of case examples tonight. And I'm going to talk to you about the way that I use it and how I think it's practical to use Sleip to help with your block evaluation. All right, well, before we start though, let's talk about what we've been doing, right? Historically, what do we do now? What do we do when we're not using objective gait analysis to evaluate blocks? Conventionally and historically, we are doing things subjectively. We're doing the best we can before we had this technology available to us. And so we eyeball it, right? And we look for improvement. And many of us commonly, we make this sort of spitball figure of 70% of improvement. And we're basing that on probably a lot of different observations that we might be making, and that we might not even be able to identify all the reasons that we're assembling into this number that we're estimating, this figure, this composite percentage of improvement. But many of us look for a 70% improvement that we want to see. And why is that? Why do we set that bar kind of high? Well, because this is the one place where I think we really do admit that we might have some bias, right? We're aware of the fact that we all want the block to work. We want to be done. We want to be right. We want to move on. Let's get the imaging. And we know that this is a place where we might make a mistake and, in fact, think a block had been positive when in actual fact it hadn't. And so we set a fairly challenging bar for ourselves, and we want to see at least a 70% improvement, whatever that means to us, and assembling that from a variety, perhaps, of clinical signs. Okay, we also might use something like a provocative test. This one can be a little bit more concrete or believable. In other words, let's say we've got a really positive flexion test, for example. We do a block, and then afterwards we check if we've ameliorated the response or perhaps eliminated the response to that flexion test entirely. That could be a positive indicator that our block has worked, has been positive. And then sometimes I use things, particularly in a sport horse or a performance horse, a subtle lameness that's only occurring maybe under saddle or under certain tasks. They might now be able, after a block, to do something that they were refusing to do before. So it could be that the willingness to pick up the lead in one direction in the canter. It could be something that you have asked them to do in terms of their willingness to slide a stop or to cut around a barrel. If they're able to do that now in a way that they were known to be able to do it before, and then your block could also be suggested to have been positive. Okay, but blocking for those of us that have done it, it's great when it's black and white, right? But that doesn't happen very often. And I think we all know that there's a lot more nuance to it than that, than just a yes, no binary question. There's a lot of variables in this equation, and that's why we have some gray, right? And what are some of those variables? Well, we know that the volume of the block we use is going to affect the outcome and the effect that we have there, using the amount of neuromuscular transmission at the sensory nerve fibers. The type of local anesthetic, we know there are differences between lidocaine and bupivacaine, right? The anatomic location, obviously, we know that depending on where we are on the leg, we might inadvertently desensitize other proximate structures that may be either proximal or distal to us just by virtue of the anatomy of the nerves in that area. How long we wait before we evaluate the blocks, right? I think many people now are moving towards a much more rapid evaluation period, but that can be difficult if you're trying to block something that you think ends up being subchondral bone pain. Those can take 30 minutes to block sometimes. By that time, we're worried about the diffusion we have, and maybe our block is not quite as specific as we might have liked it to have been. And last but certainly not least, the one that I mentioned already, the bias that we all bring with us because we are human, right? So again, we certainly have various things that could influence our perception of whether that block worked or not least of all, our desire to be right, to get on with the lameness exam, to move forward, to move on to the next case, etc. So all those things can affect whether we interpret a block correctly or not. So how would we do it objectively? We've talked about what we do subjectively and why that can be somewhat fraught and why blocking itself is inherently somewhat fraught, regardless of the methods we use to assess it. Well, here's what Sleip looks like. If you haven't seen it, that's one portion of the screen on the app, one set of results presentation. Here's another set. Here's the other slow motion analysis video. And the way that we can use Sleip specifically to assess a block is, number one, most obviously, we're going to look for a change in that asymmetry magnitude. So in other words, if we have a certain degree of asymmetry, let's say of the head in this case, between the left and right forelimbs, well, we're looking for that to lessen, right? In the same way that we would look at that subjectively and expect for that magnitude of maybe a head nod, if we want to think of it that way, to decrease, right? So seeing less of a head nod, for example. And we could see that magnitude decrease as we're measuring it and quantifying it objectively with Sleip. The second thing we might do is actually look at a change in the distribution of that vector plot, the vectors that are representative of the asymmetry on a stride pair by stride pair basis. And we're going to talk about that more in detail in just a minute, don't worry. So if that begins to be more distributed rather than all bunched together in one direction very tightly, we know that the horse has changed the way it's moved after the block, even if we haven't eliminated the asymmetry entirely, and that's important. And then last but not least, we might begin to see the layers being peeled back, right? The layers of the onion, as we know, right? So we begin to see changes in asymmetry in other legs besides the one that we blocked. We might see that some of them are eliminated, that they were in fact probably compensatory or referred lameness types of asymmetry. Or in some cases, we begin to see that new ones pop up, right? Just like when we see a horse switch, of course, that's a nice black and white block for us. Well, we see that sometimes obviously objectively too, and that is depicted and represented for us as now there's an asymmetry detected in a different limb, okay? All right, let's move on from there. So here's a case example for you. I'm going to just play this video and not the whole thing. It's kind of longer than we need. But before I give it to you, the signalment is this is a 14-year-old Arab gelding presented to me for hind limb lameness. Didn't specify which limb. I don't think they knew. And importantly, the clinical findings were that when we palpated this guy, both hind limbs, both suspensory branches were enlarged and had periligamentous swelling around them. And so this is what he looked like. So as this guy goes around, particularly right there, that left hind on the outside of the circle, we don't really expect to see that hip drop on the outside of a circle so much. I don't. That's the thing I look for when I'm looking subjectively. And you can see that that is happening for this horse. You can also see, especially when he's away on the backside of the circle, for me at least, you can see probably a bit of right front as well. Look at his withers. He's really settling down harder on the left front, just a titch, but it's there. And that would be reported for you, by the way, in the trunk data also that is now reported in terms of another point of asymmetry that Sleip looks at. So there you go. Our greatest concern was for the hind end in this particular direction. It was the outside limb, the left hind, that was most prominent to my eye. And let's see what Sleip had to say about it. Then we'll get on to how he looked after blocking. Okay, so I'm hoping that most of you have seen some Sleip results before, but I'm going to have to quickly go through it for those that might not have. This is the summary page where we land, and it tells us about the asymmetry that was detected in the horse we just saw, okay? And it is specific to that circle we just saw, which is the right circle. That's the one I'm showing you here. Now, this guy was also showing a left hind impact asymmetry on the straight line to a similar degree, but the example I'm just choosing to show you is the right circle recording. Okay. So guys, here are the curves that represent the position of the head in space over time, okay? The purple lines down here. I'm not sure if you can see my cursor or not. So down here at the bottom of this summary screen to the left, you should see some purple curves and some blue curves. The purple curve represents the head, H for head on the left, and P for pelvis down below is the blue curve. And so those purple tracings represent one pair, each line is one pair of left to right strides, the position of the head in space over time, vertically. Okay. So as it starts out, he is heading down and left is on the left. Just by convention, we always start with the left. And that lowest purple dip is where the left front impact is occurring. He's then getting ready to break over and starting to push off. And then that is where his head and body are highest, up at the top of that purple curve, right in the middle. And then he's transitioning over and heading down to the right front. And that lowest point is right front mid stance, or what's called impact. And then it gets ready to transition to break over and push off of that one. Same thing's happening down below in the blue lines, but this is with the pelvis for the hind limbs. And so you can see that that lowest dip, the first low blue dip, is going to be left hind impact. And that is not as low. In other words, the pelvis is not settling down as low. He's propping up compared to the right hind impact, which is over to the right side here, okay? And then the push-offs are the points where we're going high once again. Okay, so we're looking for the difference between the spot, this lowest spot of blue versus this one right here. And in fact, then looking for that vertical difference and turning it on its side horizontally up here, that's what this bar represents. Okay, let me explain this results table. This is sort of a 2x2 little table. Let's divide it right down the middle and you'll see left on the left and right on the right, okay? And then in half, we divide it in half horizontally like this, and we've got forelimbs on the top and hind limbs on the bottom. And if we divide this thing down the center, that's the line of zero. That's the line of symmetry, okay? So we have two lines per leg because we've got a push-off phase of the stride. That's the highest point of the head, body, or pelvis, right? And then we've also got the impact phase that is the lowest position of the head, body, or pelvis, and we're reporting both to you. So those two lines in this upper left quadrant represent the left forelimb. Right forelimb is right here in the upper right quadrant. Left hind is right here in the lower left, and right hind here in the lower right. And what we can see here is that this line coming off of zero, this is a non-zero number. In other words, it is an asymmetry that was detected in the pelvic movement, and it was attributed to the left hind limb because when the pelvis is moving less, when the head is moving less, that is generally the lame limb on the side when it's moving less, okay? Also, interestingly, there was that right front that came up that we were kind of eyeballing and seeing as well, a little bit during the push-off phase. Okay, and when we looked at the vector plots on this, every line, every vector here represents one pair of strides left to right if an asymmetry was detected. Okay, so if there was a difference left to right in the position of the head or of the pelvis, then they are reported to and shown as a line. And the magnitude of that asymmetry is reflected in the length of the line, and the limb that it's being ascribed to is the direction that the vector is pointing to. So as you can see in this head vector plot, all of these are bunching over towards the right. There's that mild right front asymmetry that we saw, and the yellow one is the mean value of all those vectors, okay? And that's similarly, but the opposite direction down here in the left hind, we see all these vectors bunching and pointing towards the left, and that one is the mean right through the middle. Okay, great. Let's move on. Here we go. So now we're looking at that same thing I just showed you. Okay, the baseline here is on the left, and we've done the comparison feature, which is something that's super easy to do. Great feature in Sleip. You can call up the results of two different recordings and put them side by side on your screen. So the one that you see here on the left is the baseline, and then the one you see here on the right, as labeled and has a little syringe and it says left hind PDN on it. I don't normally do a plantar digital block in the hind limbs, but in this case, because I was trying to stay away from the fetlock and the suspensory branch swelling and so forth and just rule out the foot first, I did that in this case, and it did not change him, right, guys? So you can see that, in fact, this left hind impact asymmetry that was yellow, in fact, if anything, it got a bit worse. Now we've moved into this orange threshold of slightly greater degree of asymmetry. Right. Okay, good. Time to move on. It wasn't the foot. So then we went up and did a low 4. So now we're up above that fetlock region, above those suspensory branches that seemed awfully suspicious. And same thing, baseline here on the left, 12:29 is the time on that one. This is that same stuff we've been looking at. And then on the right is the 13:46. This was after we added the low 4 point. And now what has happened? Our left hind impact asymmetry, shown here at the bottom line on the left with the yellow, has now switched, and now we're seeing a right hind push-off asymmetry instead, pretty dramatically, okay? And that was how it looked to our eyes as well. And when we come over here and look at the vector plots, we can see that those blue lines down here pointing all to the left have now switched entirely, and now over here to the right side with that mean actually hitting this sort of red threshold, which means a fairly obvious asymmetry. And interestingly enough, although it didn't shift from one limb to another, there has been a slight change in the way he's moving in the front end as well as a result of that change in the hind end. So interesting to note that result from a block. So we saw a change in the magnitude of asymmetry. It switched 100%, right, when we got the leg correct. And then in some cases, we begin to see a change in the distribution of the vectors. Sometimes that's in other legs, like I mentioned. Okay, here's a second case for you, and this one's interesting. This one is a 16-year-old Dutch warmblood gelding, and he is owned by a member of the Sleip team, a veterinarian. And I'll just let you watch that video for a moment quietly. Left front lameness is what he was presented for. Some of you may recognize this case. It's one that we use a lot, so I'm sorry if there's some repetition here for you. This is Gulliver. He's one of the demo horses that we often use. And I'm sure that you could all see that mild but consistent left front lameness that we saw there on baseline. In the interest of time, I'm going to move on to after the blocking. So he had an abaxial block applied to the left front. He also had a PD applied first. It didn't change him. And then this is the one after the abaxial. And I'm actually going to speed it up here so we can get to the part where he's coming back towards us. So this one's a little bit of a question mark, right? You know, you're still seeing some asymmetry. You can still see a lameness probably as he's coming back towards you. Is he a bit better? Is he not? I'm not sure. This one is, we think, a bit better, but not super convincing on this particular day. Interestingly, this horse blocked much better, even though his lesion had not changed, on simply a different day. And that's an interesting thing to keep in mind, right? So let's see what the Sleip results look like. I mentioned to you that we know the story on this guy, right? So I can tell you that the diagnosis was he had a P3 fracture. Okay, so that was found out after this blocking and so forth. And yet he blocked to an abaxial, but not super convincingly, at least not on this particular day. Let's see what the percentage was. So here on the left, we've got the one that says baseline. This is what his asymmetry value was. I've zoomed in here, so you're only seeing left front and right front in these lines, guys. You don't see the hind limbs in this one in particular, just in the interest of space and focus. And then the baseline one is, pardon me, on the left, and then the block is here on the right, noted as left front abaxial and with the syringe. And so if you move over here, you can see that the magnitude, that is the length of those asymmetry lines, has reduced, those bars. Okay, in fact, this one changed color to be a gray. That's a lower threshold of asymmetry. And then this one during impact also was reduced, still yellow threshold. Okay. And we asked Sleip to tell us, well, what is the true percentage difference, the mathematical percentage difference between that change in vertical asymmetry, not the one that you and I make up, when we're kind of spitballing and we put a bunch of things together and so forth. This is the math. And the difference was, let's say 40%, okay, reduction. And for many of us, if we looked at that and we'd say, well, that's not enough, right? That's not enough to consider this a positive block. But what I want you to know is that when you're using objective gait analysis tools, we're using them because they're more sensitive than our eyes, right? That's the point. They're going to usually often see some residual asymmetry that's still there, even after we have had a successful block. So let's see if we can find any other evidence, Gulliver, that would help support this even further. Yes, we think he's better, but that is not a super dramatic reduction in the magnitude of his lameness. But let's take a look at the vector plots. The one on the left here is the baseline, and the one on the right is after the block. Now, remember what I said about the distribution of those vectors. All of them are pointing to the left over here on the baseline. But now after that block, he's mixing it up a little bit. He's got an occasional step that, is a little more to the right rather than the left. And that distribution change tells me that he has changed the way he's moving. Does it mean that that is the end of my blocking? I mean, in this horse, we know it was, right? Maybe, maybe not, right? It might be that I'm getting warmer, but the point is I know that with this block, something changed with this horse. So either I might decide to continue. Maybe the problem is north of where I am and up in the fetlock. Maybe it's not. In this horse's case, it turns out they stopped. They did their imaging. They found the diagnosis there. And as I mentioned to you, on another day, he blocked and was measured as much as 70% reduction in his asymmetry. And that's just horse to horse, day to day. Okay. And sometimes volume to volume, right? All right, so keep in mind that sometimes things block 100%. We love it when that happens, when they switch, right? Obviously, we have more work to do, but at least we know, black and white, that that was it. We got it. But often they don't. Often we live in the gray zone with blocking. If you detect a positive change, and especially if it's a positive change that is consistent in a few different areas, perhaps not just on the one circle, but on multiple different conditions, straight line and the opposite circle, for example, or if you notice there's a difference in the distribution of those vectors, well, then the horse has changed as a result of that block. And you should then interpret accordingly, depending on what your clinical findings are. Okay, I'm going to stop there and go to the Q&A, and I'm hoping to find some. So hopefully I've stopped that sharing. I see a couple of questions here in the Q&A, but please feel free to populate that a bit more for me and dive right in. Okay. And I'm sorry about the videos, Helen. Sometimes during Zoom transmission, that quality can be lost. So I'm sorry for those of you that had some hitchiness during your videos. I know it's awfully hard to assess whether a horse is lame or not if you can't really see it as a smooth video. Apologies. We all do the best we can with the internet connection that we have. I'm sorry for that on your end. Question about interpreting Sleip results. How significant is a 0.1 change in value? If after a block, a horse worsens by 0.1, is this clinically important? Great question, but that's a good two-parter. Let me see if I can take that in a couple of different ways. First of all, something that is only, by the way, Sleip is working on pixels, guys, right? So the units here are pixels, which are not super meaningful. I don't know about you, but I don't really speak in pixels, in terms of measurements and dimensions. And the range of values that we are reporting, basically in terms of the amount of asymmetry, is going to be from 0 symmetry to 2.0 is going to be our maximum report. If it's above 2.0, you're not going to get a 10, okay? So that it would be, and that sort of 1.5 to 2 is red, 1 to 1.5 is orange, 0.5 to 1 is yellow, and there's a bit of gray. And then there's a certain amount of asymmetry that we consider to be normal, green, within normal biological variation, okay? And so a 0.1 change in value wouldn't be super exciting to me. You should recognize that thresholds are set somewhat arbitrarily. We have to decide at what point we're changing from yellow to orange. Of course, inherently, that is somewhat of a flawed thing to do. And so you might have a 0.1%, pardon me, a 0.1 change in the asymmetry, and yet you see a color change depending on where that has occurred, that 0.1, right? So just be aware of that. And that's why I ask you, hopefully, to look a little bit beyond just the color coding and beyond just the summary. Get a little more granular in your analysis. Do look at the numbers. If you're like, wow, that bar length looks about the same as the last one, and yet now it's calling it orange. So the question is that by itself, 0.1, a significant change? Not to me. I would think that that amount could be margin of error, just inter-individual variation on a given trot up. Probably not. Um, if a horse worsens after a block, that is an interesting thing, and we see that happen often when we are not in the right place, right? So we've taken some proprioceptive information away from them by numbing a certain area, and yet all the other pain is still there. They're not able to move in as strategic a way as they were before because they can't feel their foot or whatever the case may be. So sometimes we see horses worsen after blocking, and you'll pick that up a lot more now if you're using Sleip than what you might have done previously just with your eye, interestingly enough. Okay, let's move on with another question here. Thanks very much for these guys. And Yana Sorokas, thank you very much for your question. How do you report percentage improvement in your medical records? Average of impact or push off, or report each percentage difference separately? Totally up to you. So that question refers to, I showed you that you could get a percentage difference, a true quantitative percentage. You could certainly just download that PDF of that result or take a screenshot of it from your phone and just put it right into your medical record. So that would be an easy way to just send it to yourself and put it in as a picture. So you don't even have to do any typing or specifying. But if you had to pick one or the other, I guess I would choose impact in most cases, but ultimately probably want to report both still. Okay. That would be my preference as a clinician. And let's see here. Will French, hello. Hi, Dr. French. Do you interpret the percent improvement differently if the baseline asymmetry is more severe versus if the baseline asymmetry is less severe? I think there is a difference there. And the question, and that simply is a matter of there's less room for change, right? So for example, that horse Gulliver, on the day that he was more lame, where I told you he blocked, when I told you he blocked much better, quote unquote, in other words, a greater percentage of block, he had a much more obvious lameness, okay? And then the block worked better, quote unquote. But relative to that baseline is what we're always doing, right? So it seemed like that was a 70% change. So in other words, if the horse is showing a more dramatic lameness, then you might expect to more easily see a change in their asymmetry. I hope that answers your question. Let's see, great. In the first example, does the change to the right hind asymmetry indicate a second lameness? So remember the Arab that I was showing you, and I mentioned to you that the client had just presented for hind limb lameness, didn't specify. Both hind limbs on palpation had these enlarged, ugly suspensory branches that were pretty suspicious. Fetlocks were not yet dropped, but I was definitely pretty suspicious of degenerative ESPA or DSLD, as we used to say in this guy. And sure enough, that left hind blocked out. And then he switched over to the right hind, and we felt like that was absolutely real and as expected. I did think he was going to come up as a bilaterally hind limb lame horse, and that's what happened. So that's right. If you see one that switches and you have a pronounced and prominent asymmetry in another limb, well, then you have a multi-limb lameness, and you have something to pursue there, okay, in most cases. Sometimes we see that these other multi-limb situations resolve after we block one limb. I alluded to that at the very beginning. And we're going to get into that in the second and third webinar that we talk about. That is to say, I think webinar 2 coming up on March 25th is related to compensatory lameness. So we're talking about the way horses do some referred movement patterns. There are some patterns. Not all of them don't read the book, but some of them do a consistent thing. Sleip tries to present that possibility to you when it recognizes it. And sometimes then when you block those horses, you block one leg and the other one goes away too. Okay, so you have a multi-limb asymmetry, and yet one of them is real, one of them's not, right? The third webinar that we're going to talk about due on April 29th is actually going to talk about that multi-limb asymmetry situation once again, but take it a step further and talk to you about the use of trunk data and how the trunk data can help us to peel apart whether we might have something that is compensatory versus something that might be a true multi-limb. And of course, we have to add blocking in to help us with that process. So, okay, great. Let's see. I have one more question before I let you guys go here. I'm going to see if this is worth sharing with you all. Yeah, this is a great, I thank you for this comment. I'm going to share it with the group and because I think it's an interesting thing to share. This attendee says, I'd like to give my 2 cents regarding Sleip's recommendations about how much to charge. In my opinion, Sleip gives tremendous value added. And given that the competition is often charging $250 to $350 for a gait analysis, I would love to see Sleip recommend charging much more than they do, more like $150 per Sleip. Thanks for that input. We try to be fairly agnostic in presenting what a whole range of things because people like to run their businesses differently and because we all live in different markets and have different clientele and different patient populations. But I hear you, and it's interesting that we have so many people that just say, I can't pay for it. I'm not breaking even. And we think, well, how can that be possible? Even if you charge $10 a pop, you should be breaking even, right? If you're using this thing. So thanks for that. I'll pass that up the chain and I appreciate your comments. Guys, if anyone else has other things that you would like to ask, feel free to follow up with me at Jamie, Jamie, at sleip.com. You can always also reach out to hello@sleip.com. We'd love to hear from you with any questions, or if you have not yet done a demo or started Sleip, you want to investigate, get a free trial, let us know. We'd be glad to get you going. I want to also mention again that we have webinar 2 on March 25th. That's going to be at 7 a.m., not p.m. Webinar number 3 that I mentioned to you about trunk data, April 29th. Also 7 a.m., not p.m. That's Pacific. Sorry, guys. Pacific time is what I'm referring to. And then we're also starting an open session, a user roundup, a user meetup session where we can have a Zoom, not a webinar, where everybody can just talk and mingle and have some collegial interaction. And that is starting on March 9th. That'll be at 5 p.m. And you can just drop in. You can look for the link on our website for that one as well. Thanks, everyone. I see a couple more questions here, or at least one, and I'm going to follow up with that individual online regarding the high degree of variation in strides and touch base with you personally. Okay, 30 minutes of continuing ed. You made it. Thanks, everybody. Appreciate you being here. We look forward to seeing you on Sleip and at our future webinars and user meetups. Thanks, everyone. Bye-bye.